Hello, good afternoon. This is Stuart Blackwood with Blackwood Vascular. We are out here educating, empowering, and innovating. At this point, our latest problem that we came up with this week was how to prep and drape for a lower extremity angiogram. So this is a basic procedure that every vascular surgeon, I think, in America who does arterial work is doing across the country. But we have a lot of new staff constantly moving in and out, and everyone does need to eventually be trained. Everyone does it differently, and it's extremely challenging, I think, for the staff to try to figure out each surgeon's preferences. Um, so I figured I'd make a little video for my staff, and you guys could use it if you think it works for you also in your hospital. But this is in the situation where I'm doing a angiogram, and for the patients who are listening out there, basically I'm putting a catheter in the artery of the leg and traveling over the opposite side and taking pictures of the opposite leg to either find a blockage and figure out what to do with it, either with an open surgery or to um, or to treat minimally invasively with a balloon or stent. And the reason you'd be doing all of that is because the patient's either having pain in their leg, or which is due to blood flow, lack of blood flow, or um, a wound, or some other more serious issue. In any case, so this is simply the getting ready. The patient has consented. We've taken him to the operating room, and now the staff is not sure how exactly to prep and drape the patient. The residents are not exactly sure, and so in my cases, this is the first step. Is if the patient has a little bit of abdominal girth or increased abdominal obesity, what I like to do is place a silk tape across above the umbilicus, and then use additional silk tapes going from there to tape to the bed. And you don't have to put a lot; you just put enough to just gently lift up the belly, the belly, and you can also put the patient in a slight Trendelenburg position, which also helps. As you can see in this picture, here is the Bovi pad where we're grounding the patient so that in case we need to use Bovi, which we don't really plan to use in these cases, but just in case it's there, here is a bear hugger above and the patient's on a bed. They have been sterilely prepped. There's our surgical skin marking, and the prepping has been done with ChloraPrep, and you can see the orangish glow in those areas. Now, a patient might come home and think to themselves, why did I get all of this orange glow all over me if they just needed to put one little needle poke into my groin area? And the reason is because just in case something goes wrong, we might need to make a surgical incision in that area. And I think every surgeon I know has a plan A, plan B, and a backup plan to plan B, and a backup to the backup plan, etc., just to make sure we all sleep well at night. So you've prepped, you've put down. The first thing I do is I put on a blue towel in the middle, right over the genitals, and I don't go too high. I just go to the pubic bone area. And the reason I do that is number one, for privacy. Sometimes the patients are awake when we're prepping them. And I think it's just a nice thing to give the patient privacy as soon as you can. And then the second thing is just to cover the genitals for sterility purposes. This next step we're going to be doing is we're going to then proceed to tape off or towel off or square off. I don't care which word you want to use. The critical surgical site. And for the residents, just be aware that every time you do square off or add additional drapes, you narrow down your operative field. So you want to try to stay as wide as possible at the beginning. Following that, the next step I usually do is I add what's called a quarter sheet, which does not have any sticky adhesive. It's a plain sheet that we lay out lengthwise. And you can see I've put a mark here because I'm exposing a little bit of the blue towels or sticky blues. And the reason I expose that portion is so that the next step where I add the Ioban drape, which is a sticky adhesive drape, this will now um, keep everything adherent.
Daddy, we're leaving soon.
And I am going to pause my recording there. Okay, and so I'm continuing on where we left off um, before my 8-year-old, just came in and interrupted us. But We put a split sheet up next, and again it narrows down our operative field, but the split sheet goes up and the stick is just run right along the side on either side. And then following that, I cover it all, including the arms, which are left extended in this case, but could be tucked with a simple top sheet or bar sheet at the top. Now that now gives us complete stability, and the only step that's left is potentially, if you need to, you can add a additional sheet down at the foot of the bed, which you can use as an extension. In this case, we're using another top sheet, as you can see here. This is very important if you have long wires or if you need an extra table for additional instruments while you're in the interventional portion of the procedure. So you can see there's a team adding that extra drape. They're sticking it down on with the left hand or right hand of the person on the opposite side, and then pulling it down to um, to offer additional sterility. So again, if you want to, so this is the basics setup for a lower extremity angiogram, and it's super simple. It's very different if I was doing a. It would be very different if I was doing a angiogram with a C arm or a Philips, Siemens, Toshiba, anything where I actually have controls of the radiology equipment myself, and I'm actually doing both radiology work as well as the actual surgical interventional work. So in that situation, I usually have a clear sheet, what we call a hybrid or angio drape, which which I would use. So this is in this setup. This is just for small hospital or a small room in a large hospital where you have a C arm and you're doing a basic angiogram procedure. And I hope that is helpful as a way to prep and drape. I'm gonna do more videos like this, including videos for fistulas, videos for lower extremity cases, videos for pedal access, videos for antegrade access, and you can do anything you want to do. But in my cases, this is my standard, especially if I know um, already based on my preoperative planning what I intend to do and where I intend not to operate. So that is it for me. If you guys like this video, please like, subscribe, and share it. Um, I hope that this ends up on my preference card, but you know, we'll see what happens there. Never can tell. The preference card is a place where all good ideas go to die. But anyway, thanks again for tuning in to Blackwood Vascular. I hope um, to make more videos like this coming up. And again, this one was more dedicated towards the students, residents, scrub techs, people learning along the way. And hopefully, a vascular surgeon out there might use it and just say, you know what, this is actually useful for me too. Um, but thanks again, and I'll see you on the next video.